Shalom, y'all. I'm Rob. She run my family's near Mother Lady Vibes, and we are back with another video.
Let's go.
Now let's go. All right, y'all. So it is 5:06 a.m. Tuesday morning. Sweetface surgery is today. Ladybug wanted to get up to help her get ready, but no children are allowed. So it would just be my king, me, and Sweetface going to the surgery with her. She's at Johns Hopkins Hospital. If anybody know anything about all children, that's where she's going. Not where they go like for their primary care, but if anything is wrong, like if I have like a real emergency, I take them to all children's if it's something I can't handle at home or whatever. So that's who we kind of trusted with this situation. As far as what they, what I want to say, reviews or whatever for hernia repairs. If we didn't already say, Sweetface is having a hernia repair. It's very routine, and we are trusting in the Most High on it. As far as the Most High credentials is 1,000, so that's really that's what we really focusing on and stuff like that. Sweetface just woke up. Ladybug just woke up. She's gonna help Sweetface get ready. And I feel like I'm so all over the place. Like I just woke up like 20 minutes ago, like up and down. That alarm was going on. We was snoozing. So it's 5:06. We trying to get out of here by 5:30. I got Sweetface's blanket and stuff right here. I'm gonna fold up her blanket, y'all. She got her pillow. She gonna bring her own pillow. She got her clothes out and stuff. We got her hair wrap. She got her little book sack that says Sweetface on it. So she is literally about to go ahead and get ready. I told her she can bring whatever she want to bring. She's gonna bring a book and stuff like that. Do you have you got other stuff in your book sack, right? Yeah. Anything else that you want to bring that you want me to get ready for you while you go brush your teeth and stuff? No? You okay? You ready?
Yeah.
I prayed really hard last night. Like I prayed so hard last night because I was just like feeling that, just that anxiety feeling, because I'm not really with this whole surgery thing. None of my children ever had to go have surgery before. I do not like it. But I trust in the Most High. Like she's in the hands of the Most High. That's how I feel. Like that's how I believe. That's what I know for a fact. Like we are all in the hands of the Most High. We're not in the hands of men. So I pray that anybody that's hands even comes upon my baby, from the anesthesiologist to the nurses to the doctors even to all the way down to the techs, people who put their hands on her, is in the hands of the Most High. It's in the will of the Most High, and that nothing transpires that's not in His will. And so as long as I pray that, and I put that out there, and I know the Most High hear me, like I'm praying through the Ruach, like I have a peace that I know everything will be fine. Of course, I'm a mom. He's a dad. So we kind of, how you feeling?
I feel like they're going to be okay. They're going to be close to the Most High's will.
Yeah.
And that's it.
Yeah, it's very routine too. Like I know anything can happen, like things can go crazy at any point, but I mean, it's very much so like very routine. And I just know even if it was something super deep, y'all can go get y'all teeth, brush your teeth and stuff like that. We know that, anything can happen at any point, but like I said, she's in the hands of the Most High, and this is in the will of the Most High. Because for everything to transpire and work out, because at first we was having issues with like the insurance not clearing it. We was having issues with the dates because I was in school, so we had to push the date back till I got done with school. It ended up being a week after I finished school, and the insurance ended up coming through because it got approved. It got approved. Then they had ended up getting sick. They wasn't able to do it if she was sick because public school, they kept getting sick, sick, because they wasn't used to being around all those germs of public school. So Sweetface was one of the babies that did go to public school. Had to get canceled. Scheduled it again. Insurance didn't approve it. What? Why? Oh my goodness. Okay. Had to wait another 2 months. Scheduled it again. Like, remember, I was going through hell, like just trying to get this done because we had talked to Sweetface. And come here, Sweetface. I would also like for her to stay on here too, because this is not something that she had to get done. Sweetface. Remember we asked you about the surgery?
Yeah.
Why would you sit down on me? I'm still trying to get on your level. You wanted to get this done, right?
Yeah.
You want your hernia to be fixed? Yeah. It doesn't hurt her. It's none of that, but it's something that we should have. It's something that they say we should have did when she was a little younger. But me personally, like I said, Abba's timing is perfect, and it's something that we're getting done now. So she's only 7, so it's not like she's super big. They say the sooner the better, though, basically. So you want to get it fixed, right? Yeah, we didn't force her. It was nothing that we didn't persuade her. We talked to her about it, explained to her about it, and she chose to be like, yeah, I would like to go ahead and get this repaired. And that's when I started the process. Like, all right, let's see if we can get this done for you. So we at 5:14. We'll try to get out of here in about 15, 16 minutes. And yeah, let's go. You ready? All right. All right, y'all, so we are heading out. Shalom, Ladybug. My king already went down because he's getting the bed rails out of the back seat of the Jeep so that we can, so Sweetface can get in the car with ease or whatever, in and out, because, we're still moving, so we just hadn't got that out yet, but. All right, Ladybug, cut the lights off, go back to sleep. All right, I'll call you or call me when y'all wake up. Sweetface has Ladybug's phone in her boot bag. What?
The Lucy probably gonna be waking up like, where's Rara?
They gonna wake up like, where's Rara? It's okay.
They don't do.
Well, they know that you're going though.
Yeah.
Yeah, they might forget, but Ladybug, trust me, they'll remind them.
Yeah.
Alrighty. Let's see. Come on, Sweetface.
Yes, sir. That's what's up, baby.
In the back, babe. Go ahead. Not all the way over. Yeah, you want to sit right here. You want to sit here? I'll put the stuff on the other side, okay? All right. You want to lock her in, babe? All right. Lock the door. All right, y'all had walked back upstairs to change shirts because I needed something that wasn't long sleeve. I got my long sleeve one, though, just in case. Whatever. I don't care nothing about no matching. I do not care about matching. That's not one of the things I factor together when I'm getting ready. When I'm getting ready half the time, okay? I'll be hipped out anyway. As long as I got something, I'm comfortable. That's all that really matters. Huh?
I said that's messed up.
What happened?
So that person on the was a girl. It was a boy.
Oh, it's a dude.
That's a girl.
She said it's a girl. And I think it's a little boy.
Okay. I'm saying, just the three of us. Cheesy. All right, we're gonna stop by the store and grab Sweetface like a Gatorade. She can have water, Gatorade, Pedialyte. I don't know if they have Pedialyte at this store, but at this point we only have how many minutes until 6 o'clock? What time is it?
So we gotta be there 6 what?
45. Well, technically 7:15, but I gave myself 30 minutes earlier because we have to. Yeah, technically we have to be there for 7:15, y'all. But I told myself, my king, and everybody else 6:45 because I just feel like, when you give yourself a little grace period, make sure that you, early and on time or whatever. If you early, you on time, and if on time, you late.
You feel me?
You feel me?
I want Gatorade.
You want Gatorade? They got Pedialyte, but Pedialyte not cold. So, Gatorade. I want to say it's right here. Oh, look. They got Pedialyte fast hydration. You want this? You want Gatorade. You just want Gatorade. All right, what color? Pink. I'll let it go. What? Oh. You sure? You need something? You didn't want to start on the top? Alright, let's go. King pump again. I got it, baby. Come on. You excited? Yeah?
Okay.
You're welcome.
That's the wrong one, but I'll take it.
Let me go get you the right ones, them the wrong ones. Take out your green machine. Yeah, I'll run back in right now. Alright, y'all. Sweetface done had her Gatorade. So she's good. She can't have anything else now. It's after 6 o'clock. So she can't have anything else to drink. It's about 6:16. We'll be there in about 22 minutes. We will be early, but that's quite alright. We have time to park and walk in and everything. You good, King? King is driving. I'm gonna go ahead and go into prayer. I just lit my incense and everything. I got my ashtray in the car, my incense tray, and my little candle. And I'm just gonna go ahead and set up some prayers. When we don't know where the eats is at, we just send them straight up. So that's what I'm gonna go ahead and do. Because we literally are heading west right now. So I'm not gonna turn around in my seat because I got my seatbelt on. So I'm just gonna pray up, right, King?
Absolutely.
Yeah, I'm just gonna pray up. So I'm gonna go ahead and go into prayer, y'all. And yeah, we'll probably, we'll start the vlog back up when we get there. Sweet face, oh sweet face, middle child of mine. Being a mama 1, 2, and 5 times over, it still doesn't take away the anxiety, but I'm glad and I'm thankful and I'm grateful for being in this place where I can just really truly trust in the Most High, y'all. This is routine and all, but it's still my baby going under anesthesia, kind of just, I didn't like it. But I know the Most High is with us and all will be well. Ready? Little nervous. Let me see the smile. Okay.
Okay, just 2 Samuel 24, verse 14. And David said unto Gad, I am in a great strait, let us fall, not now into the hand of Yahweh, for his mercies are great, and let me not fall into the hand of man.
You heard
So
that?
we in the hand of the Most High at all times, and specifically talking about Gad. But yeah.
And she is Gad. But kind.
All praise to the Most High.
All praises to the Most High.
Isaiah 41:10. Isaiah 41, verse 10.
Okay.
Yeah. Isaiah
Ooh, I
41,
like
verse
this
10.
one. Kind.
Fear thou not, for I am with thee. Be not dismayed, for I am thy Elohim. I will strengthen thee, yea, I will help thee, yea, I will uphold thee with the right hand of my righteousness. All praise to the Most High.
Feel better? You know you're in the hands of the Most High, right? Not the hands of man. So even though you see all these people around you, the Most High got them around you.
Don't be worried.
Yeah.
Don't be scared.
Right. And your angel is with you too.
At all times.
Okay? You good? Fear thou not, for I am with thee. That's what the Most High said. That's what Abba is telling you. Okay? You got another one for her, babe?
Oh yeah, I get another one. Let's see.
I need one.
Joshua 1 verse 9. It reads, "Have I not commanded thee? Be strong and of a good courage. Be not afraid, neither be thou dismayed. For Yahweh thy Elohim is with thee whithersoever thou goest."
Whithersoever thou goest, He's with you no matter where we go.
At all times.
At all times.
Nothing to be worried about, nothing to be afraid.
You good? You ready to go in now? All right, let's get ready. Okay, guys, so we're just waiting at this point. We got her all checked in, and she is. You on the phone, babe? She on the phone with who? You on the phone with?
Momo and Titi.
Who?
Momo and Titi.
Momo and Titi. Okay. So she's on the phone with her Momo and Titi.
You are stand
Try
around.
I can't. She got to stand on it anyway.
Push your feet all the way back to the wall. Get it back. Perfect. And then look straight at mama. Perfect. Okay. Put your shoes on and grab your stuff.
Come on, boo.
Get the pink room.
Yeah, you got the pink room, babe. You got the pink room.
Can I push it back a little bit? That way you can.
Yeah, thank you.
There you go.
What's the blanket?
This is just a sticker. I'm gonna put it around your finger. Can we do your thumb?
No, you can come on. I'm just doing socks. Okay, y'all. So here's her hernia before. No, it's not causing her any pain. It's not even that big, but we do have the understanding that it will grow as she grows. So we all decided to go ahead and have this surgery done. So this is what it looks like before. Yes, we did put a quarter over it at birth, like my grandmother suggested. It just did not work with her. Actually, we did not do it at birth. We did it a couple of months after. So here we go. That they were going to put her to sleep. We didn't go as far as intubation.
Yeah, because they don't
we didn't talk about.
they're not anesthesiologists,
yeah.
so they don't know. They say that she's going to go to sleep. It's just general anesthesia, of course.
Right.
Yeah. But beyond that, as I said, there's several ways to do. Some procedures don't need anything, like when you do PE tubes, your tubes, you do upper and lower GI scopes, MRIs. Those procedures don't need anything. You can just give IV medicine, nasal cannula, and you're fine. There's some procedures which you can do with an LMA, which sits back of the throat, arterial intubation, and it goes fine. It's good. There's some procedures which need intubation, and that's what we start on it. As I said, I just want to do the right thing for her. Get it done safely.
Versus doing LMA and then have to go back and
Right.
Correct.
And
That's what I just didn't want to
anyway.
do. Just
The
keep it
steps.
one, get it
Yeah.
done, and move on.
Okay.
and that's the reason I choose this one.
Yeah.
It's just I just don't want to get in the middle.
Right.
It's like it's obstructed breathing or anything.
Right.
And the surgeon is trying to do their part. You're trying to do this. Give this 10 different things to
Right.
get that close. Just do one thing. Do it right from get go, and get it done.
So just to make sure I understand, just so that I'm mentally prepared,
Sure.
when she's going into recovery, she will still be intubated
No,
when we go
she'll
see
be
her.
out.
You're gonna extubate her before we see her.
Yes.
Much more. She's
Breathing.
being extubated in the OR.
She intubated and extubated up there.
In the OR.
Okay.
Yeah. No,
Okay.
This is not. We're not talking about ICU. We're not talking about ICU ventilation.
When you
We're not
start talking about intubation, there's so many
anything.
things going
I
through
know,
my
I
head, so
know.
I'm just trying to
I'm
make
sorry,
sure
Dr.
of what's
Chandler,
going
just
on.
talking a little
Hey,
bit
Dr. Chandler.
more about
Hey.
anesthesia plan.
We
Yeah.
didn't talk about the intubation part of it, so now I'm just not finding out about that. So I didn't really want her to be intubated, so now I'm just getting some more information on it.
That's fine.
And I'm okay with an LMA.
But I
Yeah,
mean,
we
it's
talk
looking
about
like
it just in case. I don't want to go and start LMA and then intubate. I might just go with it and get it done. And so
She
we
didn't
just
wanna-
she thought this was going to be done with only masks.
I
said
thought
that
it was
not
just
an option.
mask. I didn't know
We're not doing
that.
this
I didn't
with
know.
mask only. And I was trying to explain different surgeries where some things mask will be appropriate for PE tubes, maybe nasal canal or propofol for upper GI scope MRI. There's some procedures like foot surgery, hand surgery, some hernias I don't mind doing with LMA, and there's some procedures where we intubate. So it changes depending upon the nature of the surgical procedure, and we don't keep them intubated or take them in the packet with a breathing tube or anything. Everything, whatever we do, tube devices, everything comes out except the IV in the OR.
And you'll come let me know if there's any
If anything
issues.
changes, we let you know.
Okay.
Are you okay? I can give you a few minutes to sign. The room is turning over. You can think through this. You can get Dr. Sanders all the work
Okay.
done. And can I just listen to her if you don't mind?
Yeah,
Then?
of course.
Yeah. All right. What questions do you guys have for me?
The intubation thing just threw me.
Yeah.
It's fine, Mom. If you want, I can do an LMA. I might not put the tube down if everything goes fine.
That's the thing. With that, we still, that means you gotta do two.
No, if I need to. If I don't need to do, we can do it with the whole case with an LMA.
What are you thinking?
That's fine. I can't do it mask
Like to
only.
me, when
That's-
I'm done, that's what I
That's
said.
right.
But I ain't got time
She-
for this not working and then going to do it anyway.
Yeah,
I ain't got
she
time
did
for
it with
it.
mask.
I'll be my nurse by then.
Yeah, if you think it's reasonable to do LMA, this is
If they don't work, if they got herpes,
I
she's
said
just
something
do that.
against my-
Yeah, I think they one and done, like she said, they'll get over it.
We gonna do the intubation.
Yeah.
I'm sorry, there was a misunderstanding regarding.
okay. I just didn't
But
know.
I just want to do what's right for her. Okay?
Yeah.
Right.
Okay, so this is just the part where I'm about to sign the paperwork to allow her to go ahead and be intubated. Y'all heard the previous conversation. It was a big deal for us because we were not aware that she had to be intubated to have this process. They just kept saying like, oh, it's a real simple surgery, it's routine, blah, blah, blah. But being intubated was not something that we were aware of. And I guess from things I've seen in nursing school, being in ICU and things like that, intubation is not something that I wanted for my baby. And if you don't know what intubation is, it's basically just where the healthcare provider or like a anesthesiologist or a CRNA basically will put a tube down the patient's mouth, like down their throat to their trachea to hold and keep their airway open during surgery or while they are sedated. And we went ahead and moved forward with it. We weren't necessarily okay with it, y'all, but it got to a point in the conversation where I did come to understanding, as well as my king, that it was what's best for her. I'd rather my baby airway be protected and kept open and controlled by the anesthesiologist than, for them to try to do it with like a LMA where they just open up the back of her throat or whatever to try to keep it open. And if things don't work out, they would have had to intubate her anyway because it would have been an emergency situation. She's sedated. She's not breathing on her own. Or it would have been abdominal breathing, which we did not want because she's having surgery on her hernia. So, which is on her belly button. So, when you're abdominally breathing, your belly button is going out, it's going in, So we didn't want that. So as hard as it was, we just went ahead and, move forward with it. And ultimately, we believe that we made the right choice and the Most High is in control. She is back. We just got into this little room that we're in right now. The room is like just this little small little room that they put each family at their own little room. So this is ours. Everybody's okay. She was okay when she went back. She didn't. I thought me knowing Mariah, I thought she was gonna get a little bit emotional, but she did not. She did not.
A little easier for her.
I feel like they made it easier. I feel like we were good. I didn't get upset in front of her or anything. My king keeps saying that I'm jittery.
Yeah, you just nervous, jittery.
But I'm just trying to. I do feel a little, especially because we had the conversation about intubation, so I was not aware that she was gonna have to be intubated. That's not something that I had agreed to or that I even knew about. So me now knowing that, okay, she gotta be intubated, and I'm just like, if I would have known that initially, I would have told them no. You know what I'm saying? But of course I won't. Whatever is best for my baby. I just don't like the idea of intubation. But once I talk to the anesthesiologist a little bit more and I understand like the critical cases and stuff like that versus the more mild cases, which the Mariah case is very on the mild side. She's healthy. She's not sick. So they shouldn't have any issues with extubating her, which is basically intubation is where they do a tube like down her throat basically to secure her airway and to make sure that she's breathing with a mechanical ventilator or whatever. So she shouldn't have any problems with being extubated, which is where they take it out and she starts back breathing on her own. She said it won't get to the point where she's like bucking the tube or whatever, but which is where basically they start breathing while they on a ventilator or whatever, and it kind of starts like they call it bucking the ventilator. But she said it shouldn't get anywhere to that point. So yes, they do have risk factors or whatever. They do have risk with anything or whatever. It wasn't something that I wanted, and you understood that.
Yeah,
like my concern is like.
Oh, definitely, 100%.
Yeah. 100%. She was like, "What's your concerns?" I'm like, "I don't want to do it." She's like, "I know, but what's your concern?"
What's your concerns? I understand that part.
And I told her what my concerns were. She understood my concerns. Like, she understood. Like, I guess it's trauma. Like nursing school, like things that I done seen. Like, I don't want to see my baby intubated. You know what I'm saying? Or having to go through the process of being extubated, because that is not fun or whatever. And I guess seeing everything that I've seen in ICU, like I don't know. I guess I'm just a little bit more on the traumatized side. Seeing that my baby have to go through that, I don't really like it or whatever. But like I said, I feel like I'm kind of holding back tears a little bit right now. But I'm okay because I know that the Most High is in control or whatever. So she rolled off. Yeah, that's my piece. So I'm just waiting. We're just waiting right now for her to come back, for me to get to see the doctor and the anesthesiologist, and just waiting on them to come back. I thought we was gonna be able to be around for a little bit more of it, but they don't even let you like nothing. Like they literally just rolled off with my baby.
That's crazy. Cause when I was under that medication, when I had a broken arm, my mom was there. She said she seen everything. When they put me on the medication and when they broke them on, she seen everything.
That's also like kind of like
back in the day. I know, so yeah, like, things change.
Yeah, we talking. He messed his arm up just like 15 years ago.
Like, 14.
Probably more
15.
than that, yeah, because King, you 34.
Yeah, that's a long
so that's
time
14
ago.
years ago right there. That's 19, that's 15, 18, 17, 16. Boy, that was almost 20 years ago. That's about 19 years ago. So yeah, things is different now. Just like in the schools, things is different. You can't just walk in no more. You gotta stop at the desk. And back in the day, my mama used to walk right on in. Everybody used to walk right on in. But yeah, y'all. So now it's just the waiting part, and I'm going to try to just eat me a little snack and just rest.
Everything's gonna be okay according to the Most High's will.
Yeah. I don't like this though.
I don't know.
We just playing the waiting game. I think I paste. Whew, let's get it. Okay, y'all. We are in the surgical waiting room part now because the doctor just came and talked to us. And told us that everything went well.
Yes. All praise to the Most High.
All praise to the Most High. She intubated well. She extubated well. I'm happy. She's now like still kind of out of it, heavily sedated right now. So they want us to wait about 20 to 30 more minutes, and then they gonna come get us, and we can go in there and see her and stuff like that. So I did tell her I would be there when she woke up. So what she said was, from what she will remember, I would have been there the whole time. So we happy about that. So right now we just waiting and just stuff. We had to organize our stuff, y'all. We had stuff everywhere. We was holding pillows, blankets, and all that stuff. But well, we good. So yeah, in about another 30 minutes, we will be seeing her.
About 10 mLs of local epicycline. Hey there, how you guys doing?
Hi.
I actually just gave her Oxy like 5 minutes ago.
Okay, it's okay.
You want that red popsicle? Yeah, I think that might help. I just gave her a little Oxy mom, so she probably wants a little something on her stomach.
Oh, okay. Okay. The vlog says hi. Everybody's calling and asking about you. Yeah. That's what we expect. How you doing?
Good. My name's Megan. I'm one of the nurses.
How you doing?
I'm gonna go over all the discharge instructions and stuff with you.
Okay.
Alright, here you go. Take a few licks of this. It might make your belly feel a little better, okay?
She said her stomach was hurting.
Yeah, she was hurting a little bit.
I almost missed it.
Yeah.
In 2 days, you can take that clear bandage off.
2 days.
Yep.
Okay.
That little 4x4 will come out, and underneath you can see those steri strips. These little things that are sticking out.
Oh, yeah, I see that,
Those
yeah.
are gonna stay. Those won't go anywhere. Those will fall off on their own in about 2 weeks.
So the vlog, how you doing?
Sorry, dude.
She said, I'm ready to go home. What you say, babe? I want to go home. Okay, we about to go. Okay. So she just still kind of out of it. So she's still a little out of it. She don't want to go back to sleep as she's dozing off back to sleep. And so she seemed a little irritated, a little agitated. It's just a side effect of the anesthesia. She literally is anesthesia. She had Tylenol as well. She had oxycodone as well. So it's like she got like a triple whammy. So that's what got her kind of, groggy right now. But yeah, guys. So we about to get ready to head out of here. Can you do this? Oh. Lady, how you feeling? Huh? You okay? She's walking a little bit better, guys. This is 2 days later. Come on, I gotta take her bandage off for her thing. She still can't stand all the way straight up. Does it hurt when you stand straight up, babe? It do. You got the table, or you gonna eat on the sofa? Sofa? Huh? Hey, Tootie.
A banana.
Yeah, you can have a banana, baby. I may have to cut them in half. I don't know how many they got left. Y'all ran through them bananas, boy. I tell you. Sweetface bed is in here. She's the only one still in here. Oh, look, you can eat over here, baby. You want to eat here, or you want to get in your spot on the sofa? I got it for you. Come on.
Next time you get groceries, can you get bananas and Frosted Flakes? I'm gonna come home and get the bananas and put them in the Frosted Flakes.
Yes, I can, sir.
Let's go.
Okay, guys. I'm just fixing her pillow.
Yeah, book. I put it over there.
Yes, I can get your book.
Guess what?
Here. Where your other sock at?
Oh, if you need it, then we'll go get it.
Thank you, Tootie. Where's the book? Tootie, did you take the book? Like, can she have the book back? Thank you. Okay, Tootie wants to clearly help. Because she done took the book, disappeared with it. Thank you, Tootie. Yeah, but she's just been kind of hanging on the sofa. This kind of been her little spot, either right here or down on that side.
This is better because normally when I eat, I do like this and the bowl right here.
Yeah, so she's actually doing good. Y'all can see how she's moving around. All right, y'all. So Sweetface is gone, but just a quick update on the house while she is gone. She went with her brother or whatever to go walk to the office. They were having like a little, because I already did that over there, right there. They having like a little party, I guess like a little pool party or whatever down there, and they had like snacks and stuff. So she wanted to walk. I didn't want her to, but I went ahead and let her. But yeah, went ahead and let her go. She watered on out there like a little old lady or whatever, but I let her go. She's doing good. When she comes back, I'm gonna take the bandage off, and then she'll just have steri strips, which will fall off, they say, over the just next 2 weeks or whatever. But yeah, her bed is still in here. She's been sleeping in here by herself now. Everybody else is back in the room. Y'all, my house is starting to look like my house. We got so much stuff going on, but all praises to the Most High and His Son. Okay, y'all. Excuse my hair, y'all. I got literally just bundled on because my hair is pulled up, so it look kind of weird. But yes, my baby, she is going to, you're going to take her bandage off. Say shalom. How was your walk?
Good.
It was good today? But I think that we just moving a little too fast. You can come on, babe. Me and my king kind of decided that we kind of going to start over. She's about to get some Motrin because she's in a little bit of pain. And it's primarily because we think she just did too much today. She's been kind of getting up kind of fast. I think because she's a kid, you know, I think she's just ready. I think she's just ready to get back to her regularly scheduled program. You know, like she just ready to be kind of like, you know, back to normal. Yeah. We gotta just slow down a little bit, moving a little bit too fast, cause she hadn't been hurting, huh? And then now you hurting a little bit, huh? Yeah, I think she just did too much. Even though the doctor said she could, she didn't say she had to stay inside, had to stay on bed rest or nothing. But we just gonna just keep it to like the bathroom, maybe going out on the balcony for a few minutes, or whatever, and then just kind of laying back either on the sofa or on her bed, which is we pulled it in the living room. So yeah, let's get to it. Say to it.
To it.
Hurt? Good?
Hurt a little bit? Okay.
You need alcohol strips. You know alcohol strips, you can wipe around it.
Mm-hmm.
Do we have any? It might be in the first aid kit.
Easy.
It's us, you doing a little bit and me doing a little bit.
You want to finish it? Mm-hmm. Easy. Hurt?
All right. The stair strips we leave on there. Wow, it does feel kind of tight. It does feel kind of tight.
You're gonna go back with time.
And she also said we have to be careful because certain things can cause it to protrude back out.
I know.
So like it's best while you are healing, babe. It's best while you're healing to just go ahead and just let yourself heal, okay? We don't want to do anything that can cause the process to be longer than what it needs to be, okay? Come on, let us help you. All right, y'all. So that's the end of this vlog. We give our praises to the Most High and His Son for our baby making it out of surgery safe, and her healing process is going well. We are going to slow it down a bit, but she's doing great. Literally just gave her some Motrin today. Hadn't had no medicine all day, nothing all day. We really just think that was because she did a lot today. So we may have to do an update to see how she's doing when she gets back to normal in about 2 weeks. But we, as far as now, we give our praises to the Most High, y'all. We want to say the water for watching this video. Anything you want to say? No? She ready to go back and watch her movie, y'all. The water for watching this video. Thank you for subscribing to this channel. Make sure y'all like, share, subscribe, leave a comment down below. We appreciate y'all. We love y'all. And Sweetface, let's do it. We love y'all. And Shalom. See y'all in the next video.